Wildfires are natural disasters that can have devastating consequences for people and the environment. They can also produce large amounts of smoke that can travel far and wide, creating health hazards for millions of people. This is what happened in Alberta, Canada, in May 2023, when dozens of wildfires burned across the province, forcing thousands of people to evacuate their homes and communities. The fires were fueled by hot, dry, and windy conditions, and some were suspected to be caused by human activity. The smoke from the wildfires was so thick and widespread that it reduced the air quality in Alberta to some of the worst levels in the world. According to the World Air Quality Index, parts of Alberta had an Air Quality Health Index rating of 10+, which means the air quality may pose very serious health risks for residents, especially for the elderly, children and people with respiratory illnesses. The smoke also affected other parts of Canada and the United States, reaching as far as Missouri and New York. The smoke caused hazy skies, red sunsets and sunrises, and poor visibility. It also triggered air quality alerts and advisories in several states, warning people to limit their outdoor activities and exposure to the smoke. The smoke can cause a number of health issues, such as sore and watery eyes, runny nose and sinus irritation, as well as coughing and headache. It can also worsen existing conditions like asthma, bronchitis and heart disease. People who are sensitive to the smoke should stay indoors, close their windows and doors, use air filters or purifiers if possible, and seek medical attention if they experience any symptoms or discomfort. The smoke from the wildfires is not only a nuisance, but a serious threat to public health and safety. It shows how wildfires can have far-reaching impacts beyond their immediate locations, and how important it is to prevent and control them before they get out of hand. Alberta's Air Quality Index, AQI, has reached hazardous levels, exceeding 500, which means the air is extremely unhealthy and can cause serious health problems. But what does this number mean and how does it affect you? The AQI is a scale that measures the concentration of different pollutants in the air, such as fine particulate matter, PM 2.5, ozone, O3, nitrogen dioxide, NO2, and sulfur dioxide, SO2. The higher the AQI, the more polluted the air is and the more likely it is to cause adverse health effects. According to Environment Canada, an AQI of 500 or above is considered very high risk and indicates a public health emergency. At this level, everyone should avoid outdoor activities and stay indoors as much as possible. People with heart and lung conditions, children, and the elderly are especially vulnerable and should seek medical attention if they experience symptoms such as coughing, wheezing, shortness of breath, chest pain, or irritation of the eyes, nose, and throat. The main source of the poor air quality in Alberta is the wildfire smoke that has been drifting from British Columbia and other parts of Western Canada. The smoke contains high levels of PM 2.5, which are tiny particles that can penetrate deep into the lungs and bloodstream and cause inflammation, oxidative stress, and damage to the respiratory and cardiovascular systems. The smoke also reduces visibility and blocks sunlight, creating a dark and gloomy atmosphere that can affect mental health and mood. Some people may experience anxiety, depression, or stress due to the prolonged exposure to smoke and its effects. The air quality in Alberta is expected to improve gradually as the weather changes and the winds disperse the smoke. However, this may take several days or weeks depending on the fire situation and the meteorological conditions. In the meantime, Albertans should monitor the AQI regularly and follow the health advice from local authorities. They should also take steps to protect themselves and their loved ones from the harmful effects of the smoke, such as using air purifiers, wearing masks, closing windows and doors, and limiting physical exertion.